We think burnout only harms the caregiver, but there's a silent chain reaction most families never see until it's too late. When the person caring for your parent collapses, their health isn't the only one at risk. By the end of this episode, you'll understand how caregiver burnout can quietly shave years off a senior's life, and why the real solution isn't more coffee breaks, but something far deeper, something that can start today. And I want to start with a story, one that still keeps me up some nights. It was about 5 years ago. A close friend of mine, Mary, was caring for her 82-year-old mother. She was the kind of daughter who did everything: medication schedules, cooking, helping her mom in and out of bed, cleaning, even managing her mother's bills. She told me she could handle it all. But I remember one day she called me sounding different. Her voice was thin, her words a little scattered, and she said, "Susan, I'm just so tired. I can't even think straight." 2 weeks later, she was in the hospital herself, pneumonia. And here's the part that nobody talks about. While she was recovering, her mother's health took a sharp turn downward. That was when I first realized when a caregiver's health breaks, the senior's health often follows right behind. Dr. Harper, this isn't something most people think about when they talk about senior health, is it?
You're right, Susan. Most families focus entirely on the senior's medical needs, medications, doctor visits, physical therapy, and they see the caregiver almost like a permanent fixture in the background. But research shows caregiver burnout isn't just a personal health risk for the caregiver. It has measurable, serious impact on the health outcomes of the person they care for.
When you say measurable, what do you mean? Because I think a lot of people might be thinking, okay, so the caregiver gets tired. How does that hurt the senior?
Great question. Let's talk data. One of the most cited studies on this came from the University of Pittsburgh in 2021. Researchers followed over 900 senior caregiver pairs for 2 years. They found that when caregivers reported high burnout levels, the seniors they cared for were 63% more likely to be hospitalized within the next 6 months, compared to seniors whose caregivers had low stress levels. And it's not just hospitalization risk. A 2022 Johns Hopkins study showed that seniors with burned-out caregivers were twice as likely to miss medical appointments and 3 times more likely to have uncontrolled chronic conditions, like high blood pressure or diabetes.
So it's almost like if the caregiver's reserves are gone, they can't maintain the same level of care, even if they love that person with all their heart.
Exactly. Love isn't enough to keep someone's blood sugar steady or to notice the early signs of a urinary tract infection. Caregiving requires constant vigilance, mental, emotional, and physical, and when burnout sets in, things start slipping.
And I imagine those slips aren't always obvious.
Right. They can be subtle at first. Maybe the caregiver doesn't notice that mom is drinking less water than usual, or they forget to double-check a medication dosage, or they delay calling the doctor because they feel too overwhelmed to deal with another appointment. Over time, those small lapses add up, and for seniors, the consequences can be serious, even life-threatening.
That's so hard to hear because I know so many people, especially women my age, who are in this situation, and they'd never think of themselves as a risk factor to their parents' health.
That's one of the myths we have to address. People assume burnout is just about emotional exhaustion. But the truth is, chronic stress changes the body, your immune system, your hormone levels, even how your brain processes information. Caregivers with high stress have higher rates of heart disease, depression, and even cognitive decline. And when that's happening, their ability to provide safe, effective care naturally drops.
So it's not just about taking a weekend off.
Exactly. A bubble bath or a nap is nice, but it doesn't address the structural, ongoing stress that's breaking the caregiver down. The solution has to be sustainable, and it has to be built into the caregiving system itself, not just left to the caregiver to figure it out on their own.
I know we're going to get into that solution in a few minutes, but before we do, I want to ask, how does this actually start? What's the early warning sign that burnout is setting in?
One of the earliest signs is what I call emotional blunting. That's when the caregiver starts to feel numb. Less joy, less patience, less empathy. It's not because they don't care anymore. It's because their brain is literally trying to protect itself from overload. Another early sign is physical, trouble sleeping, headaches, stomach problems. And here's something the Mayo Clinic pointed out in a 2023 report. Caregivers under chronic stress have higher inflammation markers in their blood, which is linked to everything from arthritis flare-ups to slower wound healing.
Listening to this, I'm realizing how often we celebrate caregivers for being selfless, when what we're really doing is ignoring the fact that they're running on empty.
That's the cultural trap. We equate self-sacrifice with love, but in reality, sustainable caregiving requires the opposite. It requires self-preservation. If you burn out, you're not only risking your own health, but potentially triggering a health crisis for the person you love.
And I have to imagine there's another layer here, which is guilt.
Oh, absolutely. Guilt is one of the biggest barriers to fixing burnout. Caregivers often feel they have no right to complain because they're not the one who's sick or elderly, but guilt keeps them from asking for help, and that's when burnout accelerates.
I think we need to talk about that guilt later, because I have a feeling a lot of people listening right now are nodding along.
We will, and I'll share some specific phrases you can use with your doctor, your family, and even yourself to break that cycle. But before we get there, Susan, I want to talk about something most people miss: how burnout actually changes decision-making in caregiving, because that's where the real danger lies.
Okay, you've got me hooked now, Dr. Harper. You just said burnout changes decision-making. What do you mean by that?
When we talk about decision-making in healthcare, we're usually thinking about the doctor or the nurse, but in reality, family caregivers make dozens of micro decisions every day, many of them with real medical consequences. What time to give medication, whether to call the doctor today or wait, how much to encourage physical activity versus letting the senior rest. Now, when burnout sets in, the brain is under chronic stress. That stress floods the body with cortisol and adrenaline, and over time it literally rewires the brain to prioritize short-term relief over long-term benefit. In plain terms, it makes people more likely to do what's easiest right now instead of what's best over time.
So in a way, burnout nudges the caregiver into making more reactive, less proactive choices.
Exactly. And here's the scary part. They often don't realize it's happening. A 2022 Stanford study tracked decision patterns among caregivers over a 6-month period. Those who scored high on burnout scales were 40% more likely to delay calling a healthcare provider after noticing a symptom compared to caregivers with low burnout. And when they did act, they often defaulted to emergency care, meaning the situation had already escalated. And when you miss those early cues, you lose valuable time.
I think a lot of people listening right now are picturing moments when they told themselves, it's probably nothing, and later found out it was something big.
That's the moment I want caregivers to be aware of, because if you can catch yourself in that pattern, you can intervene. But here's the thing, it's almost impossible to self-correct if you don't have a system in place to relieve the mental and emotional load.
So this is where we start talking about the fix that lasts, right?
Yes, and I want to be very clear. The solution to caregiver burnout is not just telling people to practice self-care. That's like telling someone in a sinking boat to just think positive. It doesn't address the water pouring in.
I'm glad you said that, because I think that's the advice people hear most often, and it's not working.
Right. Instead, we need what I call the 3-pillar system for sustainable caregiving. And these pillars are grounded in research and in real-world success stories. The first is shared load. That means no single person should be the sole point of care, ever. Even if you're the primary caregiver, you need backup built into your week. This could mean family rotation, paid respite care, or community volunteer programs. A 2021 Alzheimer's Association study found that caregivers who had at least 2 backup people they could call on for a few hours per week reported 35% lower burnout scores, and their seniors had fewer ER visits over a 12-month period.
And I can already hear listeners saying, that's nice in theory, but I don't have anyone to help me.
That's where the second pillar comes in: resource mapping. Most caregivers don't realize how many local services exist because nobody ever sits them down and says, here's your menu of help. Every county in the U.S. has an area agency on aging, and many offer free respite care hours, transportation, meal delivery, and caregiver training. Yet, according to a 2022 National Alliance for Caregiving survey, fewer than 40% of eligible caregivers actually use them, mostly because they don't know they exist.
So part of the fix is literally knowing what's out there before you hit a crisis.
Exactly. The third pillar is health synchronization. This is the one people tend to skip, but it's where the magic happens. It means aligning the caregiver's health needs with the senior's care plan. For example, if the senior has a physical therapy appointment, can the caregiver schedule their own checkup nearby on the same day? If the senior's meal plan requires fresh produce, can the caregiver shop for both of them at the same time? This minimizes extra trips and reduces the mental load of juggling 2 separate health tracks. Because they were more likely to get early interventions, from counseling to preventative medical care.
And yet, I bet most people have never told their own doctor, by the way, I'm caring for my 85-year-old mother every day.
Exactly. And here's the part I want people to hear loud and clear. You are a patient too. The healthcare system will not treat you that way unless you make it known.
You know, earlier you mentioned guilt being one of the biggest barriers. And I think this is where it really kicks in because so many caregivers feel like they don't have the right to take up space in the healthcare system when they're not the sick one.
That's why I always teach caregivers a simple phrase to use with their doctor. I am the primary caregiver for someone with significant health needs, and my health directly affects theirs. This frames your care as part of the patient's care, which it truly is.
That's powerful. And honestly, it's permission a lot of people need to hear.
Susan, when we come back to this in a moment, I want to walk through a real-life example of what happens when a caregiver does speak up and how that conversation can literally change both lives. And for anyone listening right now thinking, I don't have time for one more thing, this example is going to show you how this one change can actually give you more time, more energy, and more control over your day.
Okay, Dr. Harper, I'm on the edge of my seat. Tell me about that real-life example you mentioned, the one where a caregiver actually spoke up to their doctor and it changed everything.
Sure. This is about a man named Robert. He's 67, and he was caring for his wife, Linda, who has advanced Parkinson's. For years, Robert kept his own health concerns quiet. He told himself he'd deal with it later because Linda's needs came first. Then, one day, during a routine appointment for Linda, their family doctor looked at Robert and said, "You don't look well." Robert brushed it off, but this time, instead of letting it slide, the doctor asked, Are you her full-time caregiver? Robert said yes. That was the turning point. The doctor invited Robert to schedule his own checkup right there. They found untreated high blood pressure, dangerously high cholesterol, and early signs of diabetes, all things Robert hadn't felt, but that could have led to a stroke or heart attack. Now, here's where it connects to Linda's health. After Robert got treatment, his energy came back, his mood improved, and he was able to better manage Linda's medications and therapy schedule. Within 6 months, Linda's hospital visits dropped to 0. That's the power of treating the caregiver as part of the patient's care plan.
That's incredible. And honestly, I think a lot of people listening are realizing how easily they could be in Robert's shoes.
Exactly, and this is why the caregiver burnout crisis is so dangerous. It's invisible until something like that happens, but we can make it visible by starting the conversation early before there's a health crash.
So let's make this practical. If someone's listening right now and they're thinking, I'm probably more burned out than I've admitted, what's the first concrete step they should take today?
First, acknowledge it. This isn't weakness, it's awareness. Then identify one person or resource you can reach out to this week for relief. That could be a sibling, a friend, or your local area agency on aging. Even 2 hours of relief a week can lower stress hormones and improve decision-making. And third, start tracking your energy and mood just like you might track a senior's symptoms. If you notice you're irritable, forgetting things, or feeling numb more often, those are early signs to intervene.
I love that you're giving people permission to see themselves as part of the health equation, because I think that's what's missing in most caregiver conversations. It's all about the patient and the caregiver becomes invisible.
Yes, and invisibility is dangerous. The more unseen the caregiver's needs are, the more likely both lives are to be disrupted by a preventable crisis.
I want to touch on something you mentioned earlier, guilt. Because even with all this knowledge, I can imagine some caregivers still feel bad taking time for themselves.
That's why I use a mental reframe with my patients. Think of self-care as care continuity. If you collapse, the care chain breaks. By taking care of yourself, you're actually keeping the chain intact. And research backs this up. A 2023 University of Michigan study found that seniors whose caregivers practiced structured self-care routines had 27% better health outcomes over a year compared to seniors whose caregivers did not practice self-care.
That's such a powerful way to look at it, care continuity. It takes the selfishness out of the equation entirely.
Exactly. And here's a practical tip for anyone battling guilt. When you schedule something for yourself, call it a care appointment, because it is. That might mean a walk, a nap, or a counseling session, but labeling it as part of your caregiving role makes it easier to prioritize.
Dr. Harper, before we wrap up, I want to give our listeners something they can say to themselves when they start to feel overwhelmed. Something that reminds them they're not failing.
Here's what I tell my patients. I am not alone, and I am not the only source of care. My health is part of their health. Repeat that when the guilt starts creeping in. Exactly, Susan. And if we can shift that mindset on a large scale, we can change not just caregiver health, but senior health outcomes across the country.
So for everyone listening, if you're a caregiver or you love someone who is, share this episode. Start the conversation in your family. And remember, the fix that lasts isn't about pushing harder. It's about building a system that supports both lives equally. We'll link to all the resources Dr. Harper mentioned in today's show notes. And please, take that first step for yourself today. Your health and theirs depends on it.